Hi, this is Cory Pickett. I'm a graduate student at West Texas A&M University. We're here today to perform a head-to-toe assessment on a 15-year-old female that presented to our ophthalmology clinic with complaints of decreased vision. We have already assessed cranial nerve number 2, which is her optic nerve with our Snellen chart and also with our own phoropters. We have addressed her primary chief complaint and corrected her distance vision with a new prescription for glasses and contact lenses. We will continue the rest of her exam at this time. We've checked her vital signs and they're all within normal limits. So what we'll do first is we're going to test all of your nerves in your head, your cranial nerves, okay? So we're going to start with cranial nerve number 1, the olfactory nerve. I want you to close your eyes for me. And I'm going to occlude one nostril. I just want you to tell me what you smell.
Alcohol.
Good. And same thing here.
Alcohol.
Good. Very good. So next thing we're going to do is just check your pupil reaction. So I'm going to have you just look straight ahead here. We're going to test both consensual and direct refraction. Apply it here. Here's your direct. Very good. Very good. There's no relative afferent pupillar defect. Her pupils measure about 7 millimeters in a mesopic state and 4 millimeters in a scotopic pupil or in the light. So very good. All right, next thing I want you to do is we're going to test the oculomotor nerve. I'm sorry, the trochlear nerve number 4. I'm going to have you look right here at this light. Test an accommodation, and her pupils constrict with the accommodation, so that's good. Next thing we're going to do is test her trigeminal nerve. So I want you to close your eyes for me, and I'm going to touch your face. I just want you to tell me if you feel something sharp or feel something dull or soft.
Soft. Sharp. Soft. Sharp. Soft. Sharp.
Good, sensations intact there. Next we're going to do is just check your extraocular movements on your abducens number 6, cranial nerve number 6. So I want you to just follow this pin light here, okay? Very good. Our extraocular movements are full. All right, next thing I want to do is your facial 7th nerve here. I want you to raise your eyebrows for me. Very good. Now close your eyes. Good. And pucker out your lips. And then your cheeks, like that. So there's no facial drooping that would indicate any kind of palsy. Everything is normal and symmetric. We're going to test the acoustic nerve number 8. So I'm going to whisper something. I just want you to recite it back to me.
429. 634.
Very good. So if she passed the whisper test but if it was not intact, then we would do the Weber and Ryan test, where we would test to see if the loss was conducive or conductive or sensorineury in there. So we'd use this tool there. So next thing we're going to do is just check your 9, 10, and 12. So the glossopharyngeal. So I want you to open your mouth for me. Stick your tongue out for me. And uvula rise is normal there, so it's not deviated to one side. So we're going to test your gag reflex, so it's going to be kind of weird, okay? Let's stick your tongue out again. Down in there. Stick your tongue all the way up. Alright, very good. Now I want you to do your cheeks out like that, and then stick your tongue to one side. Test your tongue straight there. Good. Same thing here. Very good. So 9, 10, and 12 are in good shape. Now we're going to do number 11, which is the spinal accessory. So I want you to shrug your shoulders, lift them out like that. Very good. All right. So next thing we're going to do is test. Just take a general look at her head. Look for everything symmetric. The eyes, the ears, the nose and face, or nose and mouth are in midline. There's no facial drooping, any sign of any kind of palsy or anything like that. We've already done part of the ophthalmic exam through a slit lamp, so we've assessed the conjunctiva, which is pink, the sclera is white, there's no lid debris, the cornea was clear, the anterior chamber was quiet in both eyes. So we're going to take a look at the back of the eye to the optic nerve. Maybe look just straight ahead there. So the optic nerve is normal. The cup to disc ratio is maybe 0.1. There's no optic nerve cupping at all that would indicate glaucoma. Remember the same thing here. And the findings are the same there, about 0.1 at the most. The macula look normal as well in both eyes. All right. So next thing we're going to do is look at the ears. Okay, I'm going to have you turn your head to the left a little bit. We're going to look at the right ear, pulling the auricle up and back. Examine the tympanic membrane. It is pearl gray. There's no bulging. It's translucent, and the cone of light looks like it's about at 5 o'clock on a clock scale. Have you turn this way. Up and back again. And same thing here. The tympanic membrane is pearl gray. There is no bulging, it's translucent. Looks like it's at about 7 o'clock for the cone of light on that. Very good. I'm going to clean that off. We're going to look at the nose next. I would normally switch. Don't have another one here right now. Let that air dry. Okay, why don't you tilt your head up a little bit for me? Side here. So the nares are good. Breathe in and out. There you go. There's no deviation of the septum. So now we're going to just do kind of a general assessment here of the anterior side while she's all here. This is not the normal place we would do this, so we're going to just kind of inspect. The skin color is appropriate to the race. There's no swelling. There's no obvious moles or nevi or lesions or anything like that. Okay, so we're going to palpate the head. Any tender areas there at all? Very good. So there's no signs of infestation or anything like that. There's no hair missing. Hair is evenly distributed, full and thick. So I want you to open your mouth for me. So I'm going to feel right into the temporomandibular joint. You can fit about 2 fingers in there. Just close and move from side to side of your jaw. Any clicking or popping? I don't feel any. Very good. Any tenderness there? So I'm going to assess the frontal and the maxillosinus area. Any tenderness there? What about here? Very good. Okay. Now, pucker your lips for me. Lips are pink and moist there. Now let's take a look at your mouth. Open again for me. So the oral mucosa is pink and moist. Now let your tongue up for me. So there's no abnormal vascular structure underneath there, so that's good. Dentition is good. You can tell she's had braces. I believe she wears a retainer from what she told me. Very good. All right. Now we're going to off there. Okay. Now we're going to palpate the temporal pulses there. They are our 2+ and symmetric bilaterally. And we're going to do the same thing here to the carotid. They are also 2+ bilateral. We'll assess the thyroid in a minute in the neck when she sits down. Okay, now I'm going to listen to the carotid, see if there's any bruit or whooshes, as we call them. Okay. Very good. There's no bruit or whooshes heard there. So now we're going to just assess the lymph nodes. We're not going to do all of them. We'll defer the inguinal lymph nodes. So we're going to do the preauricular nodes. You know, when you get an infection, you feel the thing swelling. So just tell me the tenders of the preauricular, postauricular, the occipital, cervical, post-cervical, subclavicular. You go ahead and lift up. We'll do the axillary while we're here. So any tenderness or I couldn't feel any areas there, so it's good there. Okay. Feel like I'm missing something here. All right. Now we're going to palpate the frontal area. Just feel it for heaves or thrills or anything like that. We're going to look for the point of maximal impulse, which is usually around the 5th intercostal area, right in here. Very good. Okay. So now we're going to percuss. We're going to listen for any tympany, which would indicate, or any dullness, which would indicate a lot of fluid in the lungs, or hyperresonance, which would indicate like COPD. You don't smoke or anything like that, do you? Okay. All right. And we'll defer some areas. Very good. Now we're going to auscultate or listen to the lungs. Just take deep breaths every time you feel this touch you, okay? Okay, now we're going to listen to your heart. So there's 5 areas here. We're going to listen to the aortic valve here first. And we should have S2 greater than S1 there. There it is. Very good. This is the pulmonic, and then we're going to Erb's point, where they should be about equal here. We're going to do the tricuspid. And then the mitral, be right there. Very good. Now I'm going to flip over, just listen for any murmurs or we'll call S3 or S4. We'll start at the base of the heart. Your heart's beating, that's good. Very good. Okay. So far, so good. So now we're going to just test your kind of range of motion with your shoulders here. Okay. So have you just kind of lift your shoulders straight out like that, or abduction there, and then adduction, and then like that. There you go. All right. Now we're going to bring them straight out like this, and then behind you. Okay. Now just put your arms behind your back there. So internal rotation, and then right here for external rotation behind your head. There you go. Any difficulty, any range of motion issues there? Very good. All right. So now we're going to test your elbows. So I want you to pull up. Now don't let me push you down. Okay. And then I want you to push down for me. So strength is good there, bilateral. Just squeeze my fingers while you're here. Just squeeze them as hard as you can. So strength is equal there. 5 out of 5. Very good. All right, now let's test your reflexes while we're right here. We're going to test 4. So we'll test your triceps reflex. Just kind of relax your arm. Just let me hold it. There you go. There you go. Same thing. Just hold it there. There you go. All right, now let me have your hand. We're going to do the brachioradial. So just kind of relax your elbow down. There you go. Good. Just kind of relax it down. Good. Now let's test your knees. There you go. And get it that time. There you go. All right, now we're going to test your Achilles. Now she's got a scar here, and her Achilles here is a little smaller. She's had prior surgery here, so the reaction may be a little bit different here. So reflex may be a little bit diminished on this foot. Now I'm going to test the capillary refill while I'm down here. So and it's less than 2 seconds, very brisk. And you have your fingers again. It's less than 2 seconds there too. Now I'm going to put some objects in your hand. I just want you to tell me what they are. I just want you to close your eyes for me. There you go. And just close your hand. Tell me what I put there.
A key.
So we're testing neurosensory function here, stereognosis. And close your hand.
A cat.
Yes. Very good. All right, now I'm going to draw something in your hand, a number. I want you to tell me what number I draw.
8.
Very good.
4.
Very good. All right. Okay. Now, another thing I want you to do while we're here is take your right heel and rub it up against your left calf. All the way up. There you go. And same way, alternate feet. Very good. All right, now we're going to test our pulses bilaterally. So, test your ears. Put your arms. There you go. Just your brachial. That's 2 plus bilateral there. Radial. That's 2 plus bilateral there. We're going to do behind your knees. Same thing there, 2 plus. Go to back here. Posterior tibialis. I didn't say it. We're doing posterior tibialis. Very good. We're going to do dorsalis pedis here. Just making sure everything is 2 plus and equal bilaterally, and yours is, so very good. Okay. Now, I want you to have a seat right here, and you're going to face this way here. Get all my stuff here. Okay. First thing I'm going to do is, I didn't get to finish the neck, so I'm going to palpate for the thyroid, just make sure it's not deviated. So we come around like this. Okay. So the thyroid is normal. So we're just doing a general inspection of the back. One thing I noticed, there's a little bit of a birthmark right there in the center, but other than that, there's no major areas there. So go ahead and just take a deep breath for me. So expansion there is normal. I'm going to do test here. Take a deep breath again. So So which is normal. I'm going to do check for CVA tenderness. So I'm going to hit right here. You just tell me if it's any discomfort. There you go. What about here? Very good. All right. Let's see what else I got to do here. So we're going to do listen in the back here. Actually, I'll percuss first. So same thing, we're listening for any dullness or tympany, which would indicate fluid, or any hyperresonance would indicate the lungs are expanded, like in asthma or COPD. So. Very good. So percussion is normal. We're going to move on to the listening to just normal breath sounds here next. All right. So every time I put my stethoscope on you, I want you to just take a deep breath. Good. Just listening for any adventitious breath sounds. You're good. Very good. All that sounds normal. There's no adventitious breath sounds. We're going to move on to bronchophony. So every time I place my stethoscope on you, I'm having a hard time saying that today. I want you to just say 99, okay? All right, here we go.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. There's no bronchophony in the peripheral areas, which would indicate consolidation of the lungs. So now we're going to do agophony. So I'm going to kind of do the same thing, but I want you to go E every time I place it on there, okay?
E, 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 E,
Two more. Very good. All right, so last one we're going to do is something called whisper pectoriloquy, and what that does is we'll do something similar again, but when I place it on you, I just want you to whisper like 1, 2, 3, or something like that, okay? And I shouldn't be able to hear you. Very good. Okay, so one more thing we're going to do before we stand up and test something called tactile thermicus. Just stay seated one more time, and then we'll do the bend over thing. All right. So every time I put my hands on, I just want you to say 99 again. Okay.
99, 99, 99, 99, 99, 99.
Very good. Okay, now you can stand up for me. So we're gonna do a couple tests. We're gonna do Rotberg test, just to kind of test our balance. So just close your eyes for me. Just stand there, very straight there. Just test it for any kind of balance issues. Very good. Okay. Now let's you're gonna just walk a little bit. Just take like 3 or 4 steps, just putting your feet right in front of each other. Very good. The balance is good there. Now I want you to just kind of bend over as far as you can to your toes, not hurting yourself. It's very flexible. So we're just looking for any curvature in the spine. So that's very good there. Come up about halfway. So there's no sign of any scoliosis, no lesions, any discomfort there, anything like that at all? Very good. Okay, so we're going to go do the rest of the exam on the floor since that's the best that we have, and then we'll go from there. So if you want to cover up you can. We're going to go that way. I'll need to grab my stethoscope. Okay. So now that we're here, normally we'd have a bed. I would do the jugular vein, but we'll have to just kind of partially demonstrate it here. You know, get a pin light here. Okay. So when we do this, it's easy to see the meniscus there. So I'm gonna have you turn your head to the left there. And you can see the pulsation in the jugular vein right there. So we want to measure straight across here. I would normally have it at a 30-degree angle, but this is the best we've got tonight. And we'll use a centimeter ruler there. So it's about 1.5 centimeters, which would put her within normal limits. If you'd add 5 centimeters, as it has to extend up to the aorta, but her JVP is normal. So very good. Okay. So next we're going to do is just kind of inspect the abdomen. So move your hands down for me, please. There you go. And if you push your horse down just a little bit, not very much. There we go. All right. So she's pretty young, healthy. Her abdomen's concave. I don't see any obvious pulsations or any peristalsis or anything like that. It's normal. So we're going to listen next. So when you're doing the abdomen, you don't want to do any kind of palpation or anything like that because you can disrupt the normal bowel sounds. So we're going to listen to start in the lower left quadrant here. Very good. She's got normal active bowel sounds in all quadrants. So while I've got my stethoscopes out, we're going to listen to the aortic and femoral artery. Listen for any bruise. No bruise there. And no bruise there, so we're good there. So next thing I'm gonna do is just kind of feel your tummy there. I want you to just tell me if there's any tenderness here at all. You start with light palpation first. Good. So next thing we would do is do more of a deep palpation to try to feel on the right side. We'll try to feel the liver and the right kidney. On the left side, we'll try to feel the left kidney and try to palpate the spleen best we can. Okay, so I'm going to support your back a little bit. Okay, a little bit deeper. I want you to tell me if there's any discomfort. probably should have done percussion next. We'll go back to that. So we'll percuss next to listen for any areas there. We'll also percuss to try to pick up any enlargement of the liver. Probably can't do much on the spleen on this side, but we'll do percussion next. So there's more of your dullness. So you get in the midclavicular line, usually start about the third area here to assess the liver. Don't assess any abnormalities. When we deep palpated earlier, it was smooth. So there's no percussion of the spleen there, so that's good. All right. So next thing I'm gonna do is just check your while you stay there, just keep your head back, and I'm gonna just kind of lift your leg straight. That'll assess if you got any pain in your lower back. So I'm gonna lift your leg a little bit. Any pain there in your lower back? I'm gonna dorsiflex your foot. Does that hurt anything at all? Very good. All right, gonna do the same thing here. Dorsiflexion. Any discomfort there? Very good. Okay. So now we're going to test your range of motion in your hips. So we're going to just flex your knee there. Any discomfort? Okay, so we're going to internally rotate it and externally rotate it. Any discomfort there? So range of motion is good there. So let me move over here. So same thing, flexion, and then internally rotate it. Externally rotate. You're okay there? All right, back down. Now, I want you to put my hands here. I want you to squeeze your hips out or move your legs out. Good. Abduction there. And then squeeze back in against my feet. There you go. Very good. Now, I want you to lift your arms, or lift your legs, excuse me, up against it. Very good. All right, now we're going to test your range of motion of your knees. Good flexion there. Internally rotate it. Externally rotate it, so that's good. Same thing here, flexion, internally rotate, external rotation, very good. So now, let's test your ankles there. So, I want you to push up against it, very good. And then pull towards you, pull your toes towards you, very good. So strength is the same but lateral. You can see that there's a little bit of a size difference in the two from the prior surgery. When she was a child. So I think that concludes the part of the exam for me. I'll help you up here. So being a, let me get the tool here. So don't worry, I'm not going to use this. But when we do an assessment, male or female, we want to assess kind of the sexual maturity levels of the patient. We'd of course assess the areas for any signs of any STIs or anything like that. For female patient, when we're using a speculum, we would want to pull back, and then we would insert this close at a 45-degree angle, kind of in a downward motion, and then rotate in position to be able to perform the rest of the exam. So I think that concludes our exam for this evening. Thank you very much.